Good morning, class. There are less people today, okay, but we'll start. We will start with the notes of HIV/AIDS, okay? So, everyone, please switch on your videos. The rest, please switch on your videos. Okay, so we will start. Write down HIV/AIDS in block letters, okay? HIV/AIDS. Write down AIDS, which is in bracket you write down, which is sometimes called as slim disease. AIDS in bracket you write down, sometimes called as slim disease. Bracket closed. Is a fatal illness. Is a fatal illness caused by a retrovirus HIV. Caused by a retrovirus, RETRO, retrovirus, called as HIV. AIDS, sometimes called slim disease, is a fatal illness caused by a retrovirus known as HIV. Okay? After that, below you write down HIV stands for Human Immunodeficiency Virus. Human Immunodeficiency. IMMUNODEFICIENCY. Human Immunodeficiency Virus. Next point you will write down AIDS stands for Acquired Immunodeficiency Syndrome. Acquired Immunodeficiency Syndrome. After the next point you write down the first case of AIDS was detected in The first case of AIDS was detected in 1981 in USA. 1981 in USA, and the first case in India was detected in 1986. And the first case in India was detected in 1986. Next point you write down, HIV positive is not the same as having AIDS. HIV positive is not the same as having AIDS because people with HIV may carry the virus for several years, before they develop AIDS. HIV positive is not the same as having AIDS because people with HIV may carry the virus for several years before they develop AIDS. Written till here? Is it written till here?
Yes, ma'am.
Okay. Then next point you write down, reservoir of infection. Under that you write down humans. And in bracket you write down cases and carriers. Cases, 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 and carriers, CARRIERS, cases and carriers, bracket close. Next point you write down, source of infection. Source of infection. Under that you write down, the virus has been found in body fluids such as, the virus has been found in body fluids such as blood, semen, 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 cerebrospinal fluid, cerebro, cerebrospinal, spinal, cerebrospinal fluid. Comma, breast milk, breast milk. And vaginal secretions, vaginal, vaginal secretions. Next point, you write down age. Twenty to 49 years are more prone. 20 to 49 years are more prone. In bracket, you write down most productive members of the society. Most productive members of the society. After that, you write down sex. Under that, you write down in North America, comma, Europe and Australia. In North America, comma, Europe and Australia. About 51% of cases are homosexual or bisexual men. About 51% of cases are homosexual or bisexual men. Whereas in countries such as Africa, the sex ratio is equal. That is, same number of males are affected as same number of female. Okay. So in countries such as Africa, the sex ratio is equal. Then write down high risk groups. Next point, high risk groups. Under that you write down male homosexuals and bisexuals. Male homosexuals and bisexuals. Comma. Having multiple sex partners. Having multiple sex partners. In bracket you write down prostitutes. Comma, intravenous drug abusers. INTRAVENOUS, intravenous drug abusers. Comma, transfusion recipients of blood and blood products. Transfusion, TRANS, transfusion, FUSION, transfusion recipients, RECIPIENTS, transfusion recipients of blood and blood products. And people having other sexually transmitted diseases, and people having other sexually transmitted diseases or STDs. And people having other sexually transmitted diseases or STDs. Written till here? Written till here?
Yes, ma'am.
Okay, so next point you write down mode of transmission. Mode of transmission. HIV is transmitted by three main modes. HIV is transmitted by three main modes. Number 1, parenteral. PARENTERAL, parenteral. Under that you write down blood and blood product recipients. Blood and blood product recipients. Comma, injectable drug users. Injectable drug users. In bracket you write down sharing of infected needles. Sharing of infected needles. And bracket close. After that you write and occupational injuries. And occupational injuries. Number 2 you write down, first was your parenteral, second is your sexual. Within that you write down semen and vaginal secretions. Semen and vaginal secretions, SEMEN, semen and vaginal, VAGINAL, semen and vaginal secretions. Due to unprotected sexual intercourse. Due to unprotected sexual intercourse. Third point you write down vertical. Vertical, VERTICAL, vertical. Under that you write down from mother to child. From mother to child. During pregnancy. During pregnancy. Comma, childbirth, and after birth through breastfeeding. And after birth through breastfeeding. Next heading you write down how HIV is not transmitted. How HIV is not transmitted. First point, HIV does not spread through. HIV does not spread through saliva, comma, tears and sweat. Saliva, comma, tears and sweat. Next point, toilet seats. Toilet seats. Next point, food. Food. Next point, mosquito bites. Mosquito bites. Next point, clothes. Clothes. The next point, one will not get infected by one will not get infected by talking to comma touching comma eating comma eating with or sharing common objects or sharing common objects with an HIV positive person. With an HIV positive person. Next point you write down, incubation period. Incubation period. Although uncertain, comma, but is considered as a period of few months to 10 years or even more. Few months to 10 years or even more. After that, you write down clinical manifestations. Clinical manifestations or signs and symptoms. The clinical features of HIV infection. The clinical features of HIV infection. Have been classified into four broad categories. Have been classified into four broad categories. Number 1, initial infection with the virus and development of antibodies. Initial infection with the virus and development of antibodies. Number 2, asymptomatic carrier state. Asymptomatic carrier state. A S Y M P T O M A T I C. Asymptomatic carrier state. Number 3 is your AIDS hyphen related complex. AIDS related complex.
Ma'am, heading to ki aছিলে?
Clinical manifestations or signs and symptoms. After that, the clinical features of HIV infection have been classified into four broad categories. Number 1, initial infection with the virus and development of antibodies. Number 2, asymptomatic carrier state. Number 3, AIDS related complex. And number 4 is your AIDS. Written? Yes, everyone, clear till here?
Yes, ma'am.
So, write down the first point, initial infection with the virus and development of antibodies. Under that you write down, except for a generally mild illness, except for a generally mild illness, in bracket you write down fever, sore throat and rash. Fever, comma, sore throat, S-O-R-E, sore throat, T-H-R-O-A-T, sore throat and rash. bracket close, which about 70% of people, which about 70% of people experience a few weeks after initial infection. Experience a few weeks after initial infection with the virus, comma, after initial infection with the virus. Comma, most HIV infected people have no symptoms. Most HIV infected people have no symptoms. For the first 5 years or so. For the first 5 years or so. Full stop. Next point. HIV antibodies under the same heading, okay, under that initial infection only. The first point you wrote down, then you write the second point. HIV antibodies usually take 2 to 12 weeks. 2 to 12 weeks or even longer to appear in the bloodstream. To appear in the bloodstream. Okay, so next, the second heading you write down, asymptomatic carrier state. Asymptomatic carrier state. Infected people have antibodies. Infected people have antibodies, comma, but no severe signs of the disease. But no severe signs of the disease. Except persistent generalized lymphadenopathy. Except persistent generalized lymphadenopathy. It is not clear how long the asymptomatic carrier state lasts. Okay. Next point, it is not clear how long the asymptomatic carrier state lasts. Then the third heading, AIDS related complex. A person with ARC means AIDS related complex, okay? A person with ARC has illnesses caused by damage to the immune system, comma, but without the opportunistic infections and cancers associated with AIDS. And cancers,
Opportunistic after that.
opportunistic infections and cancers associated with AIDS, comma, they may exhibit one or more of the following clinical signs. Unexplained diarrhea lasting longer than a month. Comma, fatigue, fatigue, fatigue or tiredness. Comma, loss of more than 10% of the body weight. Loss of more than 10% of the body weight. Fever, night sweats, night sweats or mild opportunistic infections such as oral thrush, THRUSH, oral thrush, comma, generalized lymphadenopathy or enlarged spleen. Generalized lymphadenopathy, LYMPHADENOPATHY, generalized lymphadenopathy or enlarged spleen.